Welcome to today's webinar, Pandemic Policies and Processes. I want to thank our sponsor, MinuteMen, and Staff HR. They're not only a sponsor, but they've been a partner with us at the Greater Cleveland Partnership for a couple of decades now, and we're very excited to have them. And thank you very much for your sponsorship. My name is Paul Federico. I work here at the Greater Cleveland Partnership for just over 30 years, serving small businesses, middle market companies, and large corporations. We are here to help the private sector. Some housekeeping. So there's a question button in your control panel. Take a second to find that. So once you find that, you know at any point, please type in a question and press enter. And what I will be doing is behind the scenes, relaying those questions to the panelists. So the panelists, we're very excited today. Margaret Burrows has her master's degree from University of Michigan. She is SHRM certified and has over 30 years, here's a theme, 30 years experience in a variety of roles in industries within human resources. A native to Northeast Ohio, Margaret returned to the area last year after working abroad, as well as in New York for 20 years. Margaret's last corporate role was Skanska USA Inc. as the VP Human Resources for Northeast region. She is currently working as HR consultant for a few organizations, including Staff HR. We also are lucky enough to have Pat Takarsik. She has 30 plus years in HR, primarily working at small and mid-sized companies in retail, wholesale, service, manufacturing, and is currently consulting. She has a bachelor's degree in human resources from Capital University, along with her HR, SPHR, and SCP certifications. We're so fortunate. We're in for a great meeting today. Without further ado, we're going to pass it over to Margaret.
Hi, everyone. Good afternoon. I'm Margaret. Pat and I are so glad to be with you today and to talk about this. So I think most of us are at a point of having COVID-19 information overload, as well as exhausted by the thought of the infection rate increasing with no clear end in sight. But especially for you, the employer, it's important to stay the course and to provide your employees a safe work environment and communicate effectively and often while you work through these very difficult and constantly changing times. We've enjoyed researching and putting this session together for you and hope that this presentation will provide you some helpful information concerning employment-related matters you should consider during these unprecedented times. So Pat and I are HR professionals and not labor attorneys. This presentation is a general overview of suggested employer practices and policies, so please consult with your own legal counsel for further advice. And let me get to that next slide. So there we go. All right, here we go. All right, so over the next 40 minutes, we will discuss first what to do if an employee from a non-essential business has COVID-19. Second, we'll also review recent employee-related legislation, as well as other requirements for you to have on your radar screen. And finally, we will discuss some recommended policies and processes. Excuse me. No, I don't have COVID. Some recommended policies and processes to use temporarily during COVID-19, as well as those policies and practices you may want to continue for your business going forward. We will mostly be using a frequently asked question and answer for our presentation format. A few of the questions we will ask for your input on the answers through the survey function on GoToMeeting. We really hope to create an interactive session of learning and sharing, and we'll leave time at the end of the session for any of your questions. So currently, the state of Ohio has 69,311 confirmed cases of COVID-19. And Cuyahoga County has 9,784, which is an increase of 18% since last week. The likelihood of someone getting COVID-19 is unfortunately currently increasing. We all see what a drain this has put on everyone. I mean, I think we're all so tired of this, and it is an enormous burden on you as the employer, since you have the responsibility to keep your operations going and really your employees safe. COVID-19 is unfortunately still with us, and the likelihood of one of your employees getting this disease is increasing. So you get a call this morning from an employee letting you know they have COVID-19. What do? Well, first, you tell the employee to stay home. And then there are some other questions that you can ask them, including if they've been tested. What are their symptoms? Who else did they notify? How long do they think they've had these symptoms? And who else did they come into contact with at work since they believe they were infected? And of course, you can ask them if they have any questions and wish them a safe and speedy recovery. Are there any other questions you would want to ask? Could you please put your questions in the question box? Any other questions you'd want to ask if someone called you this morning? Looks like, do we have any questions coming in?
Nothing yet, Pat.
Okay. All right, well, one of those questions that you might be getting, or that you might have but you're not writing in the poll, is how long does your employee need to stay home? Or the employee's asking, how long do I need to stay home? So there are 4 different scenarios to consider when answering this. First is if the employee has symptoms but has not been tested or is waiting for the test. Second is the employee has a confirmed lab test for COVID-19. Third is they have symptoms but have a negative test. And fourth is with a positive test but no symptoms. So each scenario has a different timeline. Cose will send you a copy of this presentation, which sort of gives you the timing on each of these as a reference. And since things are really constantly changing, we recommend that you check with your own council as well as the county health department or the Ohio Health Department if you get that call. But one thing for sure is after you learn your employee has been diagnosed with COVID-19, you need to act quickly and identify and notify coworkers who have been exposed during this infectious period of the employee. So prompt notification and follow-up reduces the risk that other employees will be exposed to the virus. These actions fall under OSHA's general duty requirement to provide a safe workplace, which requires you, the employer, to keep your place of employment free from recognized hazards that are causing or likely to cause death or serious physical harm. In most cases, you don't need to shut down your facility. And if it's been less than 7 days since the sick employee has been in the facility, close off any areas used for prolonged periods of time by the sick person. Wait 24 hours before cleaning and disinfecting to minimize potential for other employees being exposed to respiratory droplets. If waiting 24 hours is not feasible, please wait as long as possible. And during this waiting period, open the doors, windows, anything to increase that air circulation in these areas. If it's been more than 7 days since the sick employee used the facility, then additional cleaning and disinfectant is not necessary. Just continue your routine cleaning and disinfect all high-touch surfaces in the facility, which we know you're already doing. So now this is audience participation time. So Paul's gonna put out a survey for you to answer. And this is a first survey question. We'll have 3 altogether. And so you'll receive a question about answering yes, no, or maybe. So the question is, can I tell other employees if a coworker has tested positive for coronavirus or other communicable diseases? So we'll give you a couple of minutes, or I'm sorry, not minutes, but seconds to answer this poll. And Paul, I'll wait for you to tell me when enough answers are in.
Okay, I think we're good.
Okay. So what did our poll say? I can't read it. So anyway, the answer is no. The Americans with Disabilities Act, ADA, privacy rule restricts employers from sharing personal health information of an employee. You can inform employees that possible exposure has occurred, but do not disclose any identifying information about the individual who tested positive. So then you have to ask.
Share
Yes.
the answers, what they got. So there's the poll results. Sorry, it took me a second to figure it out.
Okay. Oh, I see it. See, yeah, the 50 put maybe too. Always a safe answer. So very good. All right, so good. Thank you so much for participating. I really appreciate you all taking part in that. So again, the answer is no, right? Because we're restricted to share personal health information. So let's say, so the next question is who was exposed, right? You'll need to determine which employees have been exposed to the virus and really take additional precautions. The time frame for having contact with an infected individual includes the 48 hours before that person became symptomatic. And an exposed employee is someone who has had close contact of less than 6 feet for 15 or more minutes with the infected individual. Most workplaces should follow the public health recommendations and instruct potentially exposed employees to stay home for 14 days, seek medical care if needed, telework if possible, and self-monitor for symptoms. We understand that they may not be possible for your business, but wanted to share these important recommendations. Also, as the opportunity to be tested has become more available, testing is another option. But I want to let you know, when I was speaking to the county public office yesterday, at this time, they're not requiring testing when you have an employee that has been diagnosed for COVID-19. That's again for a non-essential business, but that could change. So please keep on checking. So what's so important about this, what's so important about how you handle this is because you have that obligation to manage potentially exposed employees' return to work in ways that best protects the health of that employee, their coworkers, and the general public. So those who are in essential business roles may be permitted to continue to work following potential exposure to COVID-19, provided they remain asymptomatic and additional precautions are implemented to protect them and the community.
Margaret, one question came through. I saw it in there. The question has to do with, I understand if it's in a work environment, but what if I have events or programs I'm putting on with people that are outside of our organization? And let's say it's a golf outing or something like that. What is my liability?
Oh, that's a good question. And that they think the exposure may be greater than someone's less than 6 feet and with that person for more than 15 minutes. You know what, we'll research that and get back to that individual afterwards. We really sort of focus the presentation on in the workplace.
Sure.
A great question, thanks.
So there are a lot of fears and rumors going around, and as Margaret said, they're ever changing. So we need to be attentive to those fears and rumors, and communicate is huge and key during this time. You'll definitely want to keep an open door policy and make sure that management is present and they're all working together with the employees. Remind the employees, if you have one, about your employee assistance program. Or if you don't, maybe it's covered with some mental health support through your healthcare coverage. Stay in touch with employees who have been quarantined. And if any of them show symptoms or are diagnosed with COVID-19, begin another contact tracing exercise, which we'll talk about further on, to identify other employees who may have been exposed. There's a local company that I'm aware of, an executive had heard rumors that a spouse of one of their employees had COVID-19, but the employee was still working and had not said anything or notified them. So they followed up on the rumors. As it wasn't a rumor. The spouse did have COVID, and the company went through the testing and then the contact tracing process. So don't dismiss anything, keep everything, like you say, open door policy, because these will help you in the long run.
So can I ask an employee if they have as an employer, can I ask an employee if they have the coronavirus? So this is one of those answers where it's well, it's sort of, or it's complicated. ADA and HIPAA regulation does not allow an employer to ask the specifics about someone's health condition. However, an exception was made by the EEOC since we are in this pandemic. So you can ask an employee if they are experiencing any of the symptoms of COVID-19 or influenza-like symptoms, such as having a fever or chills and cough and sore throat. As public health and medical authorities learn more about COVID-19, they may expand that list of associated symptoms. So you should, we recommend that you rely on these reputable sources for guidance on symptoms associated with the disease. And these sources can also guide you when choosing questions to ask your employees to determine whether they would pose a direct threat to health in your workplace.
Can we ask an employee to get tested for COVID-19 before returning to work, especially when they're showing symptoms? Well, if the practice is applied consistently, an employer may ask an employee to be tested for COVID-19 before allowing the employee to return to the workplace. However, we know that access to the testing and employers may just want, it's not always accessible. So you may want to refer to the CDC guidelines and allow individuals to return to work without requiring a test. Can we require a doctor's note before allowing a sick employee to return to work? Again, if an employer applies this practice consistently, clearance from a healthcare provider to return to work can be required. However, guidance from the CDC suggests employers remove such requirements during a health crisis, as access, again, to healthcare providers may be limited. You'll see in the last two questions, the answer states that if the practice is applied consistently, then yes. So we know that many small companies may not have a lot of these policies and procedures, and we will talk about them further on. But a lot of it has to do with being fair and consistent throughout your process. We want to emphasize how very important it is to having that practice in place, especially in how you're handling the sickness, telework arrangements, and pay, which is also very important. And as a general HR rule, being fair and consistent in any situation, even beyond this healthcare crisis that we have, will help to minimize misunderstandings and hopefully head off any potential legal action. We will cover more in our policies and procedures further on.
And as we said, this is a question and answer format. And so we have another question is that what should you do if an employee tells you that they have been in close contact with a person who is tested positive for COVID-19? So first, confidentially question the employee further to understand the extent of the exposure. If you have someone in the HR function, ask them to question the employee versus their supervisor if possible. Remembering again that exposure is less than 6 feet and more than 15 minutes is considered at-risk exposure. So current guidance is to instruct the employee to monitor their symptoms and to work remote if possible. Also, as Pat said, if you have a consistent practice in place, you can ask them to seek medical advice about staying at home and the possible need to get tested. The main thing that you need to be concerned is about exposing your employees to the risk of the virus. So now we have a question for you. We're going to use the survey function again. And the question is, can I require an employee to go or stay home? The poll is open. Can I require an employee to go or stay home? Anyone else? All right, looks like
Okay,
90%.
we're ready. We're going to share it.
Okay. Oh, I get it. That's how you do it. Okay, very good. All right, very good, people. Very, very good. Yes. Employees who show signs of respiratory illness can be asked to leave the workplace and stay home until they are symptom-free. Very good. This class gets an A. So now we're going, yep, okay. So next slide. All right, so now we're going to move to our next topic to review employment laws and regulations that you should be aware of during this pandemic. We've already mentioned OSHA and ADA in our presentation. Let's look to see how these 6 laws and regulations identified on this slide could have an impact on your business while being in the middle of our pandemic. So employers are required to abide by OSHA's General Duty Clause, right? OSHA, Occupational Safety and Health Administration, which says you must keep your place of employment free from recognized hazards that are causing or likely to cause death or serious physical harm. If you could, identify positions, if any, with the potential for occupational exposure to the coronavirus. And we also encourage you to review OSHA Regulation Code 29, Part 1904, to determine the work-relatedness of illnesses and record keeping and reporting requirements. So there are 3 legislations that came out this spring that we wanted to review with you. Some of you may not be required to follow these newly created acts due to your size or exemption, but to remain competitive in the marketplace, you may want to consider providing some similar support if able, or at least just knowing what they're all about. So the FFCRA, or Families First Coronavirus Response Act, amends the FMLA to grant emergency FMLA leave when an employee needs to care for a son or daughter due to a public health emergency that results in a school closure, a place of care closure, or unavailability of the son or daughter's normal child care provider. The EFMLEA, or Emergency Family and Medical Leave Expansion Act, offers leave for up to another 10 weeks, depending upon need and whether an employee has already exhausted some family medical leave for other qualifying reasons. And that's subject to a statutory cap of $200 per day and $10,000 total. And then finally, EPSLA, or Emergency Paid Sick Leave Act. There are 6 reasons or categories that an employee could qualify for up to 10 days of paid sick leave, ranging from $200 a day to $511 a day. So that's why we have that alphabet soup, because there are definitely a lot of letters in that. All right. So
another question for you. I think you're going to like this one. Our questions today are pretty good. The question goes this way. We have a location in the red zone where masks are required. Our employees were all told that masks had to be worn. We have 2 employees who say they have doctor's excuses that they are exempt. We asked for documentation, even without doctor's diagnosis, just stating that they are exempt. 1 employee complied, the other refused. What should we do?
That is a great question. And I would go back to that, because the that consistency in practice and would require you to, well, you could, yeah, those are difficult questions to sort of try to do off the cuff. We'd love to set up a time to talk to you about what you can do concerning that. So you're fair and equal. And you also have to take into consideration that disability and ADA, whether you have to make a reasonable accommodation. So nothing is sort of black and white, very simple. You'll have, you need to look at the details of the situation. Pat, is there anything that you'd want to add to that question?
Well, again, I think it would also depend on the size of the organization and
Yes.
how much they have to comply under all this FFCRA and all the alphabet soup that we're talking about, and the fair and consistency. And have they done anything in the past, even before there was the coronavirus, that would be similar, that they could, again, compare it to with this individual? So there's a lot of considerations you have to put in place, as Margaret indicated, and probably would need a little bit more information in order to give you a true black and white answer.
But that's a great, but that is a dilemma, and it's good that you're concerned about how to act on that. So that's very smart on your part. All right, which takes us to ADA, Americans with Disabilities Act. So under the Americans with Disability Act, if an employee is concerned about returning because they are at a higher risk of severe illness from COVID-19 than others, they may have a disability and therefore could be protected. And you should discuss possible accommodations with the employee to address their concerns. Also, when an employee has anxiety related to contracting the coronavirus, or even in this case about wearing a mask, the employee may have a disability requiring a reasonable accommodation if the anxiety rises to the level of a disability under ADA or state laws. So now we're going to move on to our third and final survey question. So if an employee takes FMLA leave for their own serious health condition related to COVID-19, is the employee eligible for this new category of paid FMLA leave? So Paul, if you want to enter the poll on this, or have our audience answer this question. Okay, again, if an employee takes FMLA leave for their own serious health condition related to COVID-19, is the employee eligible for this new category of paid FMLA leave? This is sort of a trick question, so. And you can always answer maybe.
Okay, we're going to close the poll and we're going to get the results.
Okay, thank you. Actually, on this one, the answer is no. The new paid FMLA leave entitlement is for one reason only: to care for a child. Let me put the answer up here. So no, the new paid FMLA is to one reason only: to care for a child whose school or place of care is closed, or whose caregiver is unavailable due to COVID-19 related issues. However, the employee could be eligible for up to 10 days of emergency paid sick leave if the employee has been advised by a healthcare provider to self-quarantine due to COVID-19 related concerns, or the employee is experiencing symptoms of COVID-19 and seeking a medical diagnosis. So that one was a little bit tricky.
So here's another question. Are nonprofit organizations required to comply with FFCRA? And the answer is...
Wait, sorry.
That's okay. The answer is yes. Employers with fewer than 500 employees are included as covered employers under the FFCRA. And as we know, this is all in effect until December 31st, 2020. However, there are exemptions for employers with less than 50 employees, which I'm not sure if you're aware of, but definitely these are additional information on the Department of Labor website. On April 1st, 2020, they released further clarification as to what these exemptions mean. And there's 3 criteria to obtain the exemption, and the company only has to meet 1. And I'll do this at very high level. Again, the further information is on the website. Financial hardship. Could this cause an extreme financial hardship by following the criteria that they're being asked you to do? Are the absence of skills, specialization, or knowledge by that person being out and having to abide by all the requirements? Is that a hardship? Or would that also provide insufficient coverage in order to maintain the normal business process? So all good things to consider. The other thing you'll want to also consider is if you then grow back beyond 50 employees, you will have to abide by the full less than 500 employer requirements.
Okay, thanks, Pat. All right, somehow I missed this. Okay, so do I have to pay a non-exempt or hourly employee who are sent home from work because they are sick? So many employers provide non-exempt or hourly employees with paid time off for illness. That being said, a non-exempt or hourly employee who does not have paid leave available are not required to be paid when being sent home because they are sick. However, under EPSLA, if eligible, and they have been advised by a healthcare provider to self-quarantine due to COVID-related concerns, the employee could be paid up to 10 days. So next, what about, do I have to pay an exempt employee who is sent home because they are sick? So this is complicated, and it's definitely not a yes or no answer. So you cannot take a deduction when you do not have a bona fide leave plan in place and a person leaves for sickness or disability for an exempt employee, or someone who works a partial day, a holiday, business closure, job performance, jury duty, or military duty, but you can make a deduction when you have a bona fide leave plan in place and the employee is not yet eligible to participate in the plan or has exhausted their paid sick leave.
So what policy considerations should we have for this COVID-19 or just a normal infectious disease control policy? You'll want to consider having a process for reporting to work, social distancing guidelines, staying home when ill, extended sick time allowance due to the FFCRA, limiting travel. I know there's one local employer here that has indicated to his employees, if you can't get there by car, you can't go. So they've eliminated flying for the short term until they have more information. Telecommuting, and we're going to talk more about telecommuting. Requests for medical information and or documentation. Very important is the confidentiality of medical information. That's important even beyond the COVID-19, the whole HIPAA and ADA, everything has to be confidential, regardless if it's infectious disease or COVID-19. And then we'll talk about the contact tracing process. And you can describe your contact tracing process as part of your policy for responding to these cases and make the policy available to all employees. You want to notify them that if they get the coronavirus, they will ask to provide a list of contacts at work. And you'll want to set up processes to allow for the quick identification of the contacts, such as meeting logs. Create a list of standard questions or talking points to use during the interviews to learn the movements of the exposed person and to provide guidance for seeking medical help. Many companies are keeping some form of record so they can establish that they did in fact make the effort. But again, they have to keep it confidential and separate. And it's tough with small companies to keep things confidential because it's like family and you work so closely with each other, but it's definitely required. A recommendation, again, beyond just these COVID requirements is to document, and keep a separate folder for all COVID-19 related information and decisions for future reference in case you're ever questioned about your decisions that you made and why.
We have another good question if you want, if you guys are ready
Sure.
for one, Margaret? Okay,
Yeah, sure.
here's another good one. We sent an employee home because they had exposed themselves by going to a water park for the weekend. Again, in the red zone. We sent the employee home to obtain a face mask or doctor's exemption. The doctor told the employee to self-quarantine for 14 days. We did not tell the employee to stay home, his doctor did. Do we have to pay the employee?
Well, it depends upon the size of the employer and if you qualify or if you're required to do the EPSLA, that emergency paid sick leave that we talked about. So that that would be one possibility where they could get paid. And it also depends upon whether they're exempt or non-exempt, and if you have a sick time policy or not. So, Pat, do you want to add anything else on that answer?
Sure. And as Margaret said, it depends on the size of the company. If they're less than 50 and they could qualify for one of those exemptions, they may not have to pay them because of the financial hardship, and or if this person is critical to the work, or it leaves them short of individuals in order to get the production completed. So I hate to keep saying it depends, we need more information and it's tough to do, but we'd be happy to get that to you if offline, if we want to get more information. So other policy considerations, and every company again is different. So for us, we're just giving you the general, what we would suggest for this. So here's what we talked about earlier is the paid leave policies to reflect the regulatory requirements and actual business needs. Are you less than 500 employees? Are you less than 50 employees? And that's where those could change company to company. Attendance policies relaxed possibly to encourage sick employees to stay home. Yes, it might be a hardship in short term, but long term, will it pay off? These are questions you should ask yourself. Time off request procedures clarified to indicate when time off can be required by the employer, as your question just was asking, and should sick employees need to be sent home. PTO time versus paid sick times. And we know that many small employers don't have formal policies related to remote working arrangements, and we'll talk about that sooner too, but you'll definitely want to ensure that the policies inform employees of the measures taken to ensure their safety. So is this the new normal? We talk about the work arrangements. Is telecommuting and remote working arrangements, is that what it's going to be? I've talked to friends, neighbors, family. Some like working at home. Some can't wait to get back into the office. I think it'll probably be possibly something you'll need to be prepared for, even if it's not something that you're necessarily want to encourage going forward. Do you have a formal policy? Remember that if they are telecommuting, you have to give consideration for workers' compensation. If somebody gets hurt, were they on the job at home? Is their chair ergonomically correct? Other considerations that you're going to have to consider with telecommuting. Exempt and salaried employees, there's a little more flexibility with their hours because of how they get paid. And we'll talk more in depth on the next slide to the extra attention needed for the non-exempt hourly employees when working remote. So the extra attention is needed to manage the timekeeping policies and rules to ensure that non-exempt employees are paid properly and that they are documenting their work hours and working only when scheduled. Because you want to hold them to a set schedule, just like you would if you were working on site. That includes taking the required meals and rest breaks. You'll want to let non-exempt employees know that they are not to work off the clock, and that if they do, they must immediately report their work to their supervisor. And even if they did work and they didn't get it pre-approved, we do still have to pay them for the overtime worked. And we don't necessarily have to make that a known fact, but as to be compliant, you should pay them for the overtime, and then just have a conversation with them afterwards. When they are working on-site, obviously it's easier to better manage their hours that they work, including the overtime and the break times. So this is why a lot of companies are hesitant, especially with the non-exempt, to have them do the telecommuting. They should be adding their out-of-office message that they will not respond to emails until they return to work the next day. And this helps in reducing the chance that a supervisor will send them emails off hours. So supervisors, we need your help too in this, because I am somebody who will just, I have a smartphone, very easily just, oh, I can answer this email so quickly. It won't take but 2 minutes. Well, the 2 minutes truly is compensable. So we need everybody's help to make sure that they do it during normal business hours and that it doesn't necessarily impact their overtime. And the policies should definitely clearly state that they are refusing to report, that if the employee refuses to report their time accurately, otherwise altering, falsifying, or tampering with the time records, it is prohibited and subject to performance impacting and subject to discipline up to including discharge.
Okay. So in addition to wage and hour considerations for telecommuting, other compensation policies you may want to consider are how to handle any misused annual pay increases or missed annual pay increases, and if those will be applied retroactively. Will any pay cuts be made or revoked, and describe how you would reduce salaries for exempt employees if necessary. Talking about reviewing if there are any changes in the number of hours worked and potential impact that has on FLSA or their status change of the employee, let alone their compensation. And how will bonuses be affected, including eligibility for or continuation of the bonus program? Will hazard pay be offered or revoked, and when will you revoke it? These are some areas you may want to address in a written policy. Now, how do you address it? In response to the pandemic and the changes to the work that's being done and how it's being done, you can address these changes or modifications in a number of ways. One option is to have a standalone COVID-19 or infectious disease policy. Another option is to provide an addendum that supplements current policies for a specific duration, until further notice. Things are changing so quickly, and it's really, I think it's just hard for any of us to keep up. But we are recommending that you have some written policies in place and then clarify those that are unique policies related to COVID-19 and are temporary, and also those policies which will be permanently changed. Each business, as we saw from some of the questions that we got over the last 30 minutes, but each business has unique circumstances that need to be taken into consideration. And as always, there is just not one plan that fits all. So we've covered a lot of information in the last 43 minutes, a short amount of time. We hope that it was helpful and that you were able to have at least a couple of takeaways from this session. Really, thank you so much for your time and participation. And Paul, we look to you to moderate this last portion of the webinar. Anything else?
I think we're good.
All right. Well, thanks everyone. Pat and I both thank you. And if you have any questions, please send them to Cose, and we would be happy to follow up with you on any of your questions that you have.
Yeah, thank you everybody for joining us at the webinar today. Really appreciate your time. Thank you to the speakers. What great insights and useful information. Thank you to MinuteMen and staff HR for their great sponsorship. Appreciate that. Please reach out to us at GCP at gcpartnership.com for any upcoming programming, any questions you might have. This concludes our webinar. Thank you.
Thank you.
Thank you.